Are we all systems go? Yes. Gosh, this is a lot more people than I thought would be coming. Well, I didn't cook up this title, Reducing Variation and Improving Patient Care Through Pathways, Developing a Care Pathway for Diabetes in West Berkshire. It doesn't exactly trip off the tongue. I was invited to do this by Map of Medicine. And what I'm going to do is simply tell a story. This is a very practical session. This is how it happened to me and to us in West Berkshire. And if anyone wants to interrupt me and ask questions while we're going along, that will be fine with me. I think sometimes saving the questions to the end, it can kind of lose the impact of the moment. So thank you all very much for coming. And thank you to David Chan of Map of Medicine and others for inviting me to do this. So, right, now we come on to my slides. So my role, I'm a GP, and for the last year, I've been primary care lead for diabetes in Berkshire West Federated CCGs. And before we go anywhere with Map of Medicine, what I'm going to do is paint a bit of a picture of where we've been coming from. So, West Berkshire, quite a nice area of the country, really. It has a population of around 500,000, about 500,000. And from April the 1st, we became 4 distinct CCGs. So we're all quite small. We're about 110, 120,000 each. I'm actually in northwest Reading. Reading is divided, not geographically at all, into 2 CCGs. And we have very distinct demographies. So if you've been following the stuff that was in the press and on the BBC recently about how long you get to live, depending on which part of the country you live in, you'll know that Wokingham is the place to be. Because if you live in Wokingham, you will probably live till about 130, because they have the longest length of life. By contrast, Reading as a whole is about halfway down the league. And then West Berkshire, out Newbury Way, again, is right near the top. So there are very distinct demographies in the area. Okay, so where did all this come from? How did we get involved with Map of Medicine? Well, diabetes was identified as a key area for improvement. In fact, I think I'm right in saying, and there's 1 or 2 board members of CCGs in West Berkshire sitting around here, they can correct me. I think it was identified as the need, the area that we really needed to do something about. Surprising for an area that's pretty prosperous and not too far away from centres of academic excellence in Oxford and London, we were at the bottom of the pile. So in terms of NDA, the National Diabetic Audit, we were 3rd from the bottom. And on DM23, which is HbA1c, we were also 3rd from bottom. And these unwelcome facts went off like a neutron bomb in Berkshire West PCT, and people started shaking their heads and looking at their feet and shuffling around and thinking we really have to do something about this. There's a saying that sometimes in order to be the best, you have to be the worst. And I think if we'd been just average, maybe everybody would have shrugged their shoulders and said, okay, well, you know, we'll just carry on. But because we were so bad, and because we recognised that we ought to be much better, the powers that be decided that something needed to be done. And last year, the sort of first act was to develop a stakeholder network. And there's been a lot of talk so far in the talks that we've had from Norman Lamb this morning right up till very recently about integrated care. And one of the problems that we had in diabetes was that care was very, very fragmented. We've got people sitting in different silos: secondary care, primary care, dietetics, podiatry, medicines management, all sitting and not talking to each other. That may ring a few bells around here perhaps, but that's the way it was. So we developed a stakeholder network, and we drafted in a consultant, a chap named John Gromit. Some of you may know him. He's the Vice President of Diabetes UK and has his own company. He's not a doctor, and he came in to sort of troubleshoot and get us working, and this was his first piece of work. Stakeholder Network has got everybody, all the key stakeholders from primary care, secondary care, meds management, public health, you name it, we're all sitting around a table together, and I have to say that has been an incredibly positive and energizing experience. And in Norman Lamb's talk this morning, when he was talking about the need for integrated care, I was just saying to myself, we're right on the money here, because this is exactly what we're doing. We never had it before. One of the areas that we needed to develop urgently was a care pathway. A lot of us didn't even know what a care pathway was. We were so in the dark ages. But we did not have one. And I can remember I was at the Diabetes UK conference in Manchester in March earlier this year, and talking with colleagues who do the same sort of job as I do and in secondary care. And they said, oh, what's your care pathway like? I said, oh, we haven't got one. They went, what? You haven't got one? So this was something that we really needed to do. The other areas that we've been working on in the last year, and it's very much a work in process, HCP education, foundation, and we've got an advanced course, pit stop course we're running for injectable therapies, structured patient education, Daphne and Expert for type 1 and type 2 diabetes respectively. We've just started running virtual clinics, and we heard a bit about them this morning from the diabetologist from Portsmouth, whose name has just escaped me. We've been implementing care planning. We've done 2 training sessions, and we've got that running in several practices in Berkshire. Informatics, we've bought a program called Eclipse, which is a standalone medical record system, sucks data off all of the systems in West Berkshire, and it's going to give us informatics in spades for what's happening in diabetes and plenty of other conditions as well. And after a great deal of effort, we have a website. And one of the people who's very instrumental of that is sitting over on my left, and I know that she's very happy that we finally got it up. We saw care pathways and the development of care pathways as a crucial component, because care pathways, what we do with patients, how we make decisions about where we send them, what treatment we give them, whether they go to hospital care, whether they go to podiatry, to the foot clinic or whatever, that was not standardized. But to get something standardized that would enable us to make decisions sensibly, we thought was one of the sort of backbones that would enable us to deliver a high quality service for diabetes patients in West Berkshire. So, how did we go about it? We just got key people in a room together and locked the door. And this is where we started. It's not rocket science. It's a very basic thing to do, but that's what we did. We looked at other care pathways, of course, and we could have cribbed somebody else's care pathway. That would have been a very easy thing to do. But we all felt that we needed to go through the process. We needed to feel what it was like, and it needed to be locally developed. Yeah, I just said that. And it went through several revisions. I don't know, who here has tried to develop a care pathway? It's not easy. Just being part of this process, it's so complex. And when you're talking about a condition like diabetes, it's kind of tentacular. Its tentacles go everywhere. It goes right into the depths of the hospital. It goes right into primary care. It goes into nursing. It goes into general practice. It goes into podiatry. It goes everywhere. And to draw all those things together and make sense of them was not an easy process. One of our very talented nurses in the care pathway group drew a sort of spider diagram with everything on it. And we passed it around, and we all had a bit of a laugh. Until somebody said, no, actually, she's done a fantastic job. She's put everything together on one piece of paper. Now we just need to make sense of it. We were very fortunate. John Grummett helped us to find a consultant DSN named Anne Goodchild, who developed the pit stop course. And she was part of our group. And she helped us to take that spider diagram and make something that looked decent, something that would be presentable, something that would show what we'd been working on and put it into a usable format. How to publish, how to make that available for people. I'm a great believer in serendipity. And sometimes stuff just happens. And you're not looking for it, you didn't plan it, but it happened. And this is what happened with Map of Medicine. One of the CCG chairs, Chair of South Reading, had invited Map of Medicine to develop and host pathways for their use. And I'm not sure whether it was a bit of an afterthought, but they thought, oh, perhaps Richard would like to come into this, because I think I got the invitation about a week before the meeting. Is that about right, Karen? Yes, about right. I think so. It just occurred to somebody that we were developing a care pathway and this might be a useful thing to do. So I got the invitation from Elizabeth Johnston, would I come to this meeting? I looked at it and I thought, well, I haven't got anything better to do, so I might as well go. But I will confess, actually, we'll go back, that I did not know what the Map of Medicine was. I hadn't heard of it. And in fact, it was a great comfort to me that I met a colleague about half an hour ago. He's sitting here. And I said, you know, I hadn't even heard of it. And he said, oh, neither had I. And I don't know how many people, I'm not going to embarrass you by asking, but I had not heard of it. So she invited me to this meeting, even though I'm in a different CCG. The fact that my wife is a board member of South Reading CCG may have had something to do with it, I don't know. But anyway, this was a good bit of cross-CCG working. And it was just one of those moments. Just one of those moments that you go into, you know, we all go to lots of meetings, don't you? And some of them we're just looking at our watch and thinking, oh golly, it's time to go now. But this one, as the talk started, and David was there and a couple of others, and they began talking about what Map of Medicine is, I began to see that this, in fact, was exactly what we were looking for. And I began to get quite excited. I said, well, golly, this is absolutely terrific. We can really use this. How can we do it? And it's like there's an open door because the powers that be in South Reading CCG had already said, you can go ahead and do this. And I have to say that I think this is one of the strengths of the new world that we live in. I would have had, a year ago, I would have had nothing to do with any of this. I was just a jobbing GP, seeing patients day by day, like most of you guys are. And suddenly, I'm in this arena and dealing with this kind of stuff, and it's putting me and it's putting other people in the place where things happen. And I think that's really quite exciting. Elizabeth Johnson from South Reading agreed that we could use the Map of Medicine as a host for the pathways, not only for South Reading, but for the 4 CCGs in Berkshire West. That's North West Reading, Wokingham, South Reading, and Newbury District. So we commissioned Map of Medicine to host our diabetes care pathways. So what happened next? Simply, the consultant DSN who had worked up our pathways. She simply opened her Dropbox folder for Map of Medicine guys to have a look at and put into their format. And they have a standardized format, which we'll have a look at in a minute, which they did. And we created a link on our website. I'm still going all right. I'm just going to say here, just in passing, about websites. I don't know from your CCGs, from your neck of the woods, how many of you have dedicated websites for disease areas. We realized fairly early on that we really needed a place where patients and healthcare professionals could go to find stuff out. And the PCT commissioned a company to do this for us a year ago, which they did. And a couple of months ago, Jane Brooks, who's sitting over there, called me and said that they were just handing the material over to the CCGs, and she got her disappointment in early because she said, you're going to be disappointed. Because what the CCGs did with it was just horrible. It was so horrible that, in fact, one or two people looked at me and said, okay, Richard, you do it now. So I literally met a bloke at a dinner party who I found was a web designer and said, do you think you could do this work? And he said, yeah. And he got it up for me in a couple of weeks. I was working here very much, thank you, very much to a timetable. We had an educational meeting where all GPs and practice nurses and district nurses and Uncle Tom Cobley and all came together. It was May the 15th, and the whole subject was diabetes, and I was organising it. And I had a plan to unveil our website, Map of Medicine, and everything else. So I said to the guys, you in Map of Medicine and in the website, you've got 2 or 3 weeks to do this. And they did it. That's our web address. Unfortunately, there's no live web here, so I'm going to show you some pretty pictures. That's our website. We were very happy with that. It has bits for patients, carers, and healthcare professionals. If you go through the healthcare professional bit, eventually you come to the Map of Medicine slide, and then you go in. You need an Athens password. And this is what Map of Medicine looks like. So, oh, golly, no, we didn't want that. There we go. I'm going to come over here now. So we divided our patients into 4 tiers. I mean, this is not rocket science. This is pretty standard stuff. And then there's a drop-down menu for what you do with each of them. So if we can drop down one of them, that's tier 1. So we've got the different services, we've got annual reviews, patient education. Behind each of these icons is another icon, and there's a PDF file, in fact, that you can even print out. Okay? So everything that you need is here on the website, and it tells you what to do at various steps. Without going through it in detail, I can't really say much more about it, but I hope you get the picture. It's very pretty, it's very user-friendly, and we like it a lot. What next? We want to use this as a foundation to develop our HCP education. We want it to be the standard for our HCP education, pointing everyone to it to help them make decisions and to refer patients more appropriately. The challenge now that we've got it up, you know, heave a big sigh of relief, oh, we've got it up now, it's working, you can see it, is to actually get people to use it a lot. And I'm just going to say something here which may cause a few hackles to go up, and that is you need an Athens password to go into it, and I think that's nonsense. Why do you need a special password to go into it? We spend our lives with passwords. I want patients to go in and see this. I want patients to have a look at it and say, here, I should be getting this, I should be getting the other, and going to us and saying, why aren't you referring me to a dietitian? Why can't I see a podiatrist? I've got something wrong with my feet. And I lay that as a challenge. I know actually it's not Map of Medicine's fault. I know there's a whole thing here. But this is not secret information. It's not, guarded by the Official Secrets Act. And I think people should be able to see it. So there we are. Care pathways, Map of Medicine can host them. And thank you very much. Hello, Maha. Hang on. There's a microphone here. Yeah.
I used to work for Berkshire, so I remember those days that everybody panic running around the place saying, oh my God, how come we're at the bottom of the table? Where is Berkshire now? Has there been any improvement?
Very good question. Has there been any improvement? We don't know yet. There has to be improvement. We've put the right things in place. We've got structured patient education, proper structured patient education. We didn't have it before. We've got a care pathway. We didn't have it before. We've got Daphne. We didn't have it before. The right stuff is there. We've got a stakeholder network. We weren't talking to each other before. It's got to be better. Hello. Microphone just here.
Is your CCG or the Federation of CCGs rolling this out into other areas to try and reduce variation across the board? Because that's what we need to be doing for referrals and reducing our costs.
Yes, it is. I don't know the detail on that. Karen, can you give the detail on that? Lady over there. I know you like speaking in public meetings.
Hello, I'm Karen Granham from South Reading CCG, and we've been working with David Chan to roll out a number of pathways. We've been looking at the areas where we need to make most improvement. So we've identified what our priorities are within our CCG, and there are 6, 7, David, pathways that we've worked with you to put onto Map of Medicine. So it's part of an ongoing programme of work.
Hello, my name is Miriam Kingsley from Map of Medicine. Thank you, Richard, for doing the talk.
Yeah.
I just wanted to pick up on one of the points you mentioned about access in Athens.
Yes.
This is just a note for the other members in the audience that the Map of Medicine is actually integrated with GP systems now, so there is a quicker way to access it other than Athens as well. But we're on stand J30 if anybody wants to see how that works. Thank you.
Okay. But it needs to be accessible for patients too.
Yeah, absolutely, yeah.
Yeah. Yep, any more? One over there.
Thank you for the presentation. Glenn Griffiths. I work with a GP that actually offers patients access to their record online. And there are many of the patients of that practice who are patients with diabetes who actually benefit from doing that. I didn't see any in your presentation any mention of patients actually getting access to their own health information. Just wonder if you had something to say about that. And just one note, we also provide access to the national Map of Medicine pathway. So I'd like to talk to you afterwards, because actually there's a national one which actually is helpful. It's not the local one, but that can be done. So the question, though, is about access to personal health.
Okay, thank you. Actually, we will be developing access. The informatics system that we've bought called Eclipse does have a patient portal. We're only just landing it now. We've got about 50% of the practices across West Berkshire signed up to Eclipse. But when we've got a bit more than that and it's up and running, we're going to be opening a patient portal, and we'll be giving patients cards. They can get into it through nhspatient.org, and they'll be able to get access to their notes, and they'll be able to interact with consultants and with GPs. It's a brilliant system. Let me tell you about Eclipse. Have you got some time? Okay, I think we're done. Thank you very much.